Good morning. We're going to allow people to join, some more folks to join, and we'll get started in just a couple of minutes.
Perfect.
Welcome. Thanks for joining us. We're just going to give it a minute or two. I see that the number of folks joining us is still increasing, so we'll get started in just about a minute or so. Okay, I think we can get started now. So welcome. Thank you so much for joining today. It's morning here, and I'm not sure what time it is where you are in your home country, in your region, but we're happy that you were able to join us today. My name is Emily Fritz. I work at the International Students and Scholars Office. I do a combination of items at the ISSO. I do some advising. I may have advised some of you on your I-20 requirements or your visa requirements, and I do some of the operational tasks as well at the ISSO. And I am joined today by Amy Premack at the Health Services Office, and she and her colleague Diana will be presenting some important information about health services requirements, specifically immunization requirements at UMass Lowell.
Welcome, everyone.
So I thought we'd go ahead and just get started first. I wanted to provide some updates as I am sure that there's a lot of talk about this given what we've experienced in the last year, a lot of things changing rapidly. And I just wanted to put some information down here for students that I thought would be helpful. So UMass Lowell does plan to return to full on-campus operations for the fall semester in accordance with the state and federal CDC guidelines and local guidance. And they do also plan on increasing the number of residential students here on campus. My office, we have been having staff in the office actually since September of last year, on a staggered schedule and of course adhering to social distance guidelines. And we do look forward to welcoming more students on campus in the fall. And now that the vaccine is more readily available in the US, a lot of people are getting vaccinated here. So we're excited to kind of go, I shouldn't say go back to normal, but create sort of a new normal that we have, that we'll have here in the US, in Massachusetts, and on campus as well. Last year, in response to the COVID-19 pandemic, the Student and Exchange Visitor Program, and that's the DHS program that oversees the F1 and the J1 student visa program. They came out with guidance pertaining to schools having to adapt their delivery of courses to remote learning to allow for some students to continue to study remotely. But for any new student that was outside of the US planning to come to the US, they unfortunately did not allow these students to partake in remote learning while in the US. So starting that F1 program through fully remote. And so with that being said, we had a number of students that were required to have in-person learning, at least some on-campus learning delivery mode for the fall 2020 semester as well as the spring 2021 semester. And, you know, SEVP has not come out with guidance for the fall 2021 semester. And we're also hearing that they may not actually come up with specific guidance for the fall 2021 semester, and that the guidance may actually be pushed out further. And so what this means essentially is that all students, all of our initial students will be required to have some type of on-campus learning. So it's a good plan to be prepared that you will be required to be attending some in-person classes. And so that should not be a problem because UMass Lowell does plan on returning to a full on-campus operation. So we don't think that that will be problematic. But certainly, you know, if you have health concerns or, you know, you have concerns that are impacting your decision to come to the US, please do reach out to the ISSO office as soon as possible so that we can work with you to determine the best plan of action for you here. And so information about the UMass Lowell plan for fall 2021 can be found on the following website here. It's uml.edu/alert/coronavirus. You can actually just go to that first section of the link and you should be able to find the, right on that link, there's a page that says returning to campus fall 2021. But that entire page is just a repository for a lot of good information, as well as the return to campus plan, which does cover mask mandates, social distancing guidelines, cleaning and sanitation information. So that's a really great resource that I do recommend students to check out. In addition, ISSO has our pre-arrival webpage, and information that can be found here is the pre-arrival guide, the welcome guide, how to coordinate airport transportation. We do offer airport transportation pickup free of charge. Our office does cover the charge of that, and that can be pretty expensive. And now with COVID involved, it's even more difficult to rely on public transportation, just in case, you know, there's not as many public transit options available to you. But even with outside of COVID, it was pretty difficult because there's not a direct way really to UMass Lowell or to Lowell from the airport. So I would definitely recommend that students take advantage of that airport transportation. It's a really great opportunity for you to be able to come off the plane and have somebody waiting for you and kind of help you coordinate getting to where it is that you're trying to go in the Lowell area. So without further ado, I will pass this over to Diana Walker-Moyer in the Health Services Office. Diana, thank you so much for joining us.
Thank you. Good to be here. And I apologize for being a little bit late. And Amy and I are in the office because together right now, and we do not have masks on, but we're both fully immunized. So I just want to make that clear. We're being as careful as we can. So
okay, Diana, can I interrupt you for just a minute? It's a little bit hard to hear you.
Okay.
Diana, you're going to need to use the mic in the headphone set.
Okay. Back on mic.
Okay, can you hear us?
Is that better?
That is perfect. Awesome.
Excellent. Okay. Sorry about that. All right. So welcome to the Wellness Center. This is what it looks like from the outside. We are currently starting most visits with telehealth visits and then followed by an in-person visit if necessary. And this is what it would look like if you came to our offices. Otherwise, it's a Zoom meeting, which you would get that link for an appointment. We can go to the next slide. Thank you. So there are requirements of being a student at UMass Lowell related to your health. There's some insurance requirements, and I can talk about those if we had questions, but our health records requirements are very important. Given that we're in a pandemic right now, we are really wanting to not have an epidemic on top of a pandemic. So there are a number of vaccine preventable illnesses for which immunizations are required, and they are required by the Massachusetts Department of Public Health, as well as the University of Massachusetts Lowell. So it's not just our policies, but there are also state regulations around these. So we do have health record requirements. Emily had just referenced their pre-arrival information website. And if you go to their, new students pre-arrival, this information, there are links to this there as well. So please do avail yourself of that information. Our health records have a couple of different components to them, and we do ask that you complete them as soon as possible prior to your arrival. We require at least a month prior to your arrival. And since you can arrive as early as August 1st, we'd expect them by July 1st if you're planning on arriving 30 days prior to school beginning. So have your records with us 30 days before that, but at minimum by August 1st. So the UMass Lowell forms are available on our website under health requirements and forms. Again, these are also on the ISSO webpage under pre-arrival information requirements. You would need to access our student portal. And if you're a currently enrolled student or currently accepted student, you can go onto the health services webpage and link to that health services patient portal and begin your process of establishing your account there. There are a couple of pages that you can complete of your health history. Page 1 is one that's more demographic information. So it would include your name, your date of birth, your address, emergency contact information. If you under the age of 18, there's a permission there for us to speak to parents. The second page of the health history is your own physical health history, as well as some family health history. We like to have that information because if we were to see you and there was something that seemed unusual, we could look and see if that was part of your history and it could be normal for you, or it could be something that you're more at risk for because you have a family history of a condition. So those are things we like to have for our information to better serve you. The tuberculosis risk assessment is required of all students attending UMass Lowell, domestic and international, and that there are 3 questions there that assess your risk for having contracted TB bacteria, which could be present in your body, although not cause active infection. And so if you answer those questions, it may direct you to get a TB test, which can be done by a blood test or a skin test. You can have that in your home country. We ask for it close to the time in which you are arriving in the United States. We do have that here as well. The next part of it is to download your immunization record. There's a place where you can actually enter immunizations, but we also do need a copy of that immunization record downloaded to the patient portal. So we have verification from your medical provider that you received those vaccinations and when they were received. We also have a physical assessment form. That is not required. We do ask for it for the same reasons that we ask for your health history, so that it would give us a little more information on perhaps what your blood pressure normally is, if you have certain joint issues, whatever it might be, that are noted on a physical examination, we'd be able to follow up with those. The physical assessment is the only piece of this that is not truly required. We just ask for that. So have these forms completed by your medical provider and then upload them to the patient portal. Go to the next slide. So these are the required immunizations. They have to be given in a certain order and a certain distance apart. For instance, the hepatitis B vaccine, many people are getting it at birth at this time. The second dose is a minimum of 28 days after the first. And then the third dose is usually 6 months after the first dose. So there are certain requirements of when they must be given, as well as the vaccine doses that have to be given. And these are just some examples of the types of vaccines that are given and the amount of doses that you would need of each one. These are, again, the particulars to this are on our webpage under the requirements section. There's a immunization form there. That form does not need to be completed, but it does have the specifics of information that's required on it if you were to present it to your medical provider. You can attach your own immunization record to that form when you submit it, but your form does need to be uploaded to this. Going through these, hepatitis B, 3 doses, the measles, mumps, rubella, 2 doses, the varicella, 2 doses. Varicella is chickenpox, or those can all have blood tests that indicate immunity as well. So you don't if you don't have evidence of the vaccines, we recommend that you get blood tests to see if you do have evidence of immunity. If you have evidence of immunity, that's fine. If you do not, then you will need to receive vaccines. The TDAP is a tetanus with pertussis in it, and we need 1 dose of that within 1 dose total. They first came out in 2005, so you need to have a dose since that time frame. And then it's good for 10 years. So after that, you have to have a TD booster. So make sure you've had a tetanus immunization within 10 years, but at least 1 dose has to be a TDAP. And then the meningitis vaccine is required for all students 21 years of age and younger. And the dose, you have to have had at least 1 dose after the age of 16. The state also does allow you to waive this vaccine, and there is a waiver form also available on our website that you may complete if you haven't had the vaccine and decide that you do not want to get it. It is recommended for people who are going to live in a congregate housing, so where there's a number of people living, the increased risk of spreading it in that population when people living close together exists, so that we recommend that for people who are living close together. If you're going to be living in an off-campus apartment with 1 to 2 people, it's probably not as necessary. And then people have questions about the COVID vaccine. At this point in time, UMass Lowell is not requiring it. A lot of institutions are beginning to go in that direction. It would not surprise me if it doesn't become a requirement, but it is not currently required. My recommendation is that if you can get the vaccine, please see if it's a US FDA approved vaccine. Those will be the ones that we'll be able to accept. So please look for those. Those are the ones that most people, the Moderna, Pfizer, and the Johnson & Johnson, which I do believe will soon come back into use here in the United States. So if you can get a vaccine, I do recommend doing that. And then please keep a good record of it because we want to make sure that you've had it, and don't lose that piece of paper because that will also impact the need for you to quarantine or if you are exposed to the illness when you're here in the United States. So right now it's not required, but I do recommend vaccination because it may become required before you get here. And next slide, please. This is what our page looks like if you go to the health services page, and the blue box kind of in the middle, I know this is small, it's hard to read, is the link to the patient portal. You would click on that, and then if you go to the next page, Emily, what comes up looks like this, and this is your registration page for the portal. So it would assist you to, you'd put in your name, and please put in your name exactly as it is in the SIS system. SIS feeds into our Medicat system, and so it will do your name exactly as you have it there. Your date of birth, your student ID number, and then it'll prompt you, it'll send you an email with a link to create a password so you have your own protected health information account. This account is where you'll upload information. There's also some health education information on there. So if you had sprained your ankle on a weekend and you want to know how to take care of it yourself, there's some information there on how to do some self-care until you can get to some medical care. There's also a way for us to communicate directly with you through a secure portal. So this is an important place to be registered for. And you do need to register for it. If you register and you get into it and then later you have problems with it, usually it just requires a password reset. But this is what you would need to begin with to upload your information and to complete the forms that you can complete even at this time. If you don't have all of your other records, you certainly could go in and complete your health history form and your tuberculosis risk assessment. Once you have completed some paperwork, you will get some information from us that says, thank you, you've submitted some information, your record is incomplete, and it will note what you still need to submit to us. If you have completed everything, you'll also receive an email that says everything is complete. I'll make note of the fact that we understand that some countries don't have all of the same vaccines as we do. We do have a list of those. So there are only a few that are unavailable in a few countries. If that is a problem for you, we can certainly work with you on your ability to get those vaccines once you get to the United States. But there's only a couple of the vaccines and there's only a few countries that have that. So most countries you have the ability to get all of the vaccines or at least the blood work to see if you've had the vaccines or perhaps the illness. So do begin to work on that now. Easier to do it ahead of time than at the last minute when you've got a lot more stuff on your mind and you're trying to pack and get over here. But again, if you could begin that process by filling out your health histories, your tuberculosis risk assessment, and then take a look at the immunization records that are required. If you have a record, you could upload it. If you don't have a record, please go to your medical provider, taking our sheet with you so that they have a guide for what it is that's necessary, and then begin that process to get your information collected before you get here. We are being much more strict on it at this time. So students who are intending to live on campus, that they won't be able to move in if you're not complete on your records. So begin this process soon so we can help you to be able to have a seamless transition to UMass Lowell. And I think that's all I have. Yes.
Great. Thank you so much, Diana.
Sure.
And we do have a Q&A feature on the webinar. So if you have any questions, you can go ahead and find the Q&A button near where your navigation options are. And feel free to ask any questions there, and we will do our best to answer. You can ask questions about immunization requirements, as well as anything ISSO related. Okay, we have some questions coming in here. What I will do is just read the question aloud, Diana, and if you can do your best to answer them or refer them as needed. So we have a question here. If I take another vaccine for COVID, one that is not available on the US, would that be okay?
I don't know at this point in time. What I will be also looking at will be what World Health Organization it recognizes as acceptable vaccines. There are some vaccines that came out very early on that may not be accepted. So at this point, I'm afraid I can't answer the question directly. Right now, we're recommending if people can get one that's a United States agreed vaccine. I know there are a number of European countries, especially, that are using some of the same vaccines that we're using here. So your best bet is if you can do that. If it's a different one, we will look at it. Yeah, and the second question, similar, if the FDA approved vaccines aren't available in the location, I recommend getting a vaccine, because you want to be immune for this illness if possible. So don't wait if that's the only thing that you can get. And then what we'll have to be looking at that as it goes on. Again, everything changes kind of on a week-to-week basis here, and we're still talking, 4 months, 4.5 months before school starts. So I'm anticipating that there'll be more guidance for us at that time. And the TB test, do we need to retake it even if we took it in the past to study in the US? Yes, we recommend that it's given within 6 months of arrival is what the recommendation is. So yes, please do repeat it. And we are kind of leaning towards the blood test if you can get the IGRA test. If not, the skin test is acceptable. And currently, we'd be looking at your history. There are 3 questions. One is, were you born in one of the countries where there's increased risk? The other is if you've traveled in one of the countries where there's increased risk. And the third was if you've ever been exposed to somebody that you know had tuberculosis. So if you've ever been exposed, and quick lesson on this is that tuberculosis bacteria can lay dormant in your body, and we call it a latent tuberculosis infection. And it may not cause active illness at the moment, but it could in 5, 10, 15, 20 years later. So we're just looking to see if that latent bacteria is present. If it is, then there's the potential for you to become ill with it and spread it to others at some point in the future. And we would then require you to have a chest X-ray to make sure you don't have current TB infection in your lungs, which is how you spread it to others. TB can also infect other organs, bones. We had a student here with tuberculosis in the brain. So it can be something that you might want to know if you've got a latent infection or not. But that is why we require it to be repeated, because there's always the potential that you got re-exposed and then had tuberculosis bacteria lie dormant.
Thank you, Diana.
Yep.
Okay, next question here is, how long would it take to get all the vaccinations listed in the slide in the order given, as there are multiple doses for each vaccine?
The total would be about 6 months. The hepatitis B is the longest series, so it's 1 and then 28 days, 1 more, and then 6 months after the first. So 5 months later, the third. The MMR is 1 dose and then on or after the first birthday. So people sometimes get them early. You need to pay attention. That has to be after the first birthday and then 28 days later. Varicella doses are also given after the first birthday, but again, 28 days apart. And the TDAP or tetanus can be given at any time.
Great, thank you, Diana.
Mhm.
We do have one question for ISSO. Will we get a letter from ISSO stating that we will have in-person classes for F1 visa purposes? We do have a letter of like this that we were using in the fall of 2020 as well as the spring of 2021. Given that most universities are planning to return to full on-campus operations, we have not yet released the fall 2021 letter, just because we weren't sure whether it was truly necessary. If you're finding that the U.S. Embassy is asking for that letter, please let us know so we can get it to you. However, we haven't seen that it's been a need just yet. So let us know if you need that. We'll absolutely provide that to you because we want to support you in getting a visa approved. Okay, we have a next question here. I'm having some trouble with getting the TB test, mumps vaccine, and Tdap. Could it be possible to get them in the US? I could not find them in my country.
Sure, a couple things. Let me start with the mumps vaccine. If it's one that you haven't had, you could certainly get a blood test to see if you have immunity, because many people do have had mumps. So I would start with getting a blood test, and it is hard. I don't think we can get a straight mumps vaccine here either. It's a combined measles, mumps, rubella vaccine is typically what's available. So first, if you can't get any vaccine with mumps in it, I would have a blood test to make sure you haven't had mumps at some point in time. You present that evidence to us and we can verify that the mumps vaccine is not available in your country. TDAP, similarly, there's no blood test for that though. So what I would recommend is if you cannot get the TDAP, again, we know which countries don't have that available, but I would recommend that you have a tetanus vaccine. So at least one tetanus containing vaccine, because we want that protection for you. And then you could get the TDAP when you come here. With a TB test, there is a blood test also called the IGRA or IGRA test that you could possibly get that if they don't have the tuberculin skin test present. The thing with the TB test is if you've ever had a positive skin test, we want you to get the blood test. We don't want you to get another skin test. And then once if you've had a positive, it will require a chest x-ray. But again, I would recommend trying what you can get first as far as the blood work goes. And then if you can't get that, certainly our medical records person, Amy Premack, will work with you around being able to arrange to get that when you get to the United States.
Thank you, Diana.
Oh, and can you start? Yes, you can start. The question is, when can we start with our immunization tests? You can begin anytime. So we want you to go ahead and begin. You can, if you have the record of immunizations or can get a record of the immunizations themselves, start with those. If you cannot get a record of the shots, then go ahead and begin with some blood tests, and then upload those to your portal, your patient portal, and then Amy will review those and let you know what your next steps are.
Thank you.
And the sooner you do that, the better, because if everybody's doing it at the same time, it can take some time to have that happen. Typically, within 3 to 5 days, you'll hear back from her.
Great, thank you. And we did have somebody put in the chat just a question about this webinar. So it is recording, and we will post the recording on the ISSO Webinar Wednesdays page. You can find that actually just through the pre-arrival page. You can also find it through the events tab on our website. But here's the direct link actually here on the PowerPoint slide. We'll post the recordings to that page. We also have, while we don't have any more questions, we'll hang around for a couple more minutes just in case we see any more questions come through. But we do encourage you to review our upcoming pre-arrival webinars as well on the link that's on the PowerPoint, and continue to review that pre-arrival information as well as the health services requirements, register for that patient portal. The more information and the more things that you can kind of do in advance, like Diana said, the better off, especially, you know, as international students, you know, you're already preparing sort of for arrival by applying for your visa, by making those travel arrangements. So the sooner the better for a lot of this content and a lot of these action items.
And I'll just add from the residential life side, I know speaking with them, you are able to sign up for rooms at this point in time if you plan on living on campus. However, when it comes to the time when of your arrival and you're trying to set up an appointment to move in, you will not be able to move in if your records are not complete. So although you may have that reservation for a room, you won't be able to get into it if you don't have your immunization records complete or worked with us on that.
Thank you, Diana.
Okay.
It looks
Some
like we have
countries.
another question coming in.
COVID vaccines for younger students will probably not be available till after the semester starts. So students under the age, well, currently it's available for everyone 16 years of age and older in the United States. I don't know what the limitations are in other countries at this point in time. So I'm assuming that that will move on because we do want children to be getting immunized. So I would try that. If it comes, since COVID vaccines are not required right now, I would just continue to watch that. And as they become available, please do, as I said, avail yourself of that. And if not, I believe you will be eligible to get them in the United States once you're here, but again, it can take 6 weeks to get that immunity. It's a 2-dose series, you get one, and the second one of Moderna is 4 weeks later, and then it's 2 more weeks before you reach full immunity. Pfizer would be 5 weeks, and the Johnson & Johnson is 2 weeks because you get one, it'd be 2 weeks later. So depending upon what's available and what you'd be able to get, it takes several weeks to do that, and that could impact your ability to attend classes if the vaccine is required. That could be a problem. So try to get that if you can where you're at. And if I plan to take COVID vaccine, should it be after all the vaccinations listed, or can I take it anytime between other vaccinations? That's a very good question. They don't want you to have a vaccine with from 2 weeks before you get a COVID vaccine until 2 weeks afterwards. So if you are going to have the COVID series, and it's a 2-shot series that could take 5 to 6 weeks, then it's going to be 2 more weeks before you can get, so it'll be 8 weeks before you could begin a vaccine series. I would recommend getting your other vaccines first and then waiting 2 weeks, just 2 weeks to begin the COVID series. So I would recommend the other vaccines, your MMR, your Hep B, your TDAP, and your varicella. It'll be a little bit tricky because some of them, if you've had none of them, for instance, the varicella is 2 doses, 28 days apart. So you would get one, and then 4 weeks later you'd get the second one, and then 2 weeks after that you could begin your COVID series, because you could get 2 MMRs, 2 varicellas, and 2 hepatitis Bs all at the same time. Well, I'm sorry, one MMR, 1 hepatitis B, 1 varicella, all at the same time. And then 4 weeks later, get those 3 shots again, and then begin your COVID series. So that would be probably the most time-effective way to do it.
Great, thanks, Diana. Okay, well, I would just like to thank Diana and Amy for attending today. And thank you all so much for joining. We are available for questions if you want to reach out to our departments. You can always reach out to international@uml.edu. And Diana, can you confirm the best email address to reach out and for any questions pertaining to immunizations?
Yes, it would be student immunizations with an S. So student immunizations at uml.edu.
Awesome. Thank you so much, everybody, for attending. We look forward to welcoming you to UMass Lowell in the fall semester. And thanks again to our presenters. Have a great day, everyone. Thank you.
Thank you all.